Nice to be sitting with you. I'm excited to be sitting with somebody who has committed to supporting perinatal wellness services. I'm curious about your journey to philanthropy. And I'm also curious about how you made your way to this intersection between funding and birth work.
It's been a long journey. I mean, I come from working in reproductive health, but on the other side, in abortion and contraception, and like many of us, getting radicalized and learning about our own histories, gathering our own experiences. When I was very young, I had an interaction with a midwife, just for gynecological care, and something changed in my brain to start thinking about, what if I can have access to this kind of care for something I have to do every year? What could be possible for everybody?
Yeah.
So I then started this journey to get to philanthropy, and really came into this space saying, oh, there's all these incredible people doing this work: midwives, doulas, birth workers, reproductive justice advocates, just everyone across the spectrum, and seeing that the money wasn't flowing to them, but also coming from this space of running a healthcare center in a place like Texas, in a place where they do not want you to exist, and doing that with these margins that were unrealistic and tight, and trying to make sure people received really quality care and that the staff were taken care of too, right? This entire holistic approach to this working. And I had so many questions about why resources weren't flowing to direct service, to the care that was happening, and to what was seemingly outside of the system, but everyone was accessing it. So I got to Tara Health as a program officer there, and spun out to build Orchid, bringing all of that knowledge, all of the relationships, all of that understanding of what's happening in our community, the ecosystems, the work people are doing. There's so much opportunity, and we were missing it. We were missing it with a frame of maternal child health or reproductive health or reproductive rights, and not looking at what was possible and what was working. So I don't want to drone on and on forever, because I want to hear from you, but that's been my journey. And now we're here and we're building this fund that is all about the infrastructure around it. How do we care for and support the people who are building differently, building new, and taking us in the direction that we need to go for better care, better experiences, and just better resources in our community. So now I want to hear from you. And I know a lot, obviously, but tell us about your journey, who you are, your experience, and what you're building in Oakland.
I first want to say that I've heard your story, and this is the first time I really digested that a midwife inspired your journey, that one interaction with the midwife, which ended up sort of influencing how you are contributing to funding for birth workers. My story is kind of similar in the sense that I was inspired by a midwife. I got pregnant when I was a young woman, and I did what I was supposed to do. I went to the local clinic, and I just felt like there should be more. I knew I wanted a deeper experience. I knew I wanted to be a part of directing my healthcare, or at least influencing my healthcare. And so I hired a midwife late in my pregnancy, and it was extremely transformative and different from what the women in my family were saying they had experienced in their pregnancies, dramatically different. I come from a long line of people who had cesarean sections, and I had a really successful, empowered home birth. And I wanted my story to be shared constantly, because I got tired, and I am still tired of people talking about how traumatized they were during their birth journey. hearing those stories really required me to step into birth work, especially from Black women. I was constantly hearing from Black women that they were feeling abused, honestly, during their birth experience. And so I became a midwife, and I trained in a birth center. I worked in several different types of birth centers. And then I was a part of opening a birth center that was a part of a federally qualified health center. And this was after years of being in conversation with Black midwives about how to make this model of care more accessible. We're still in constant strategizing around how to make this model of care, which changes outcomes, which people report enjoying much better, more accessible to low-income folks and people of color. And so I kind of became known to the city of Oakland as the Medi-Cal, which is, we call it Medi-Cal in California, Medicaid midwife. And I loved that. I appreciated that people saw themselves in me and were willing to consider a different birth option because they saw someone who they felt connected to representing that. And slowly that evolved into Birthland. Birthland is I founded this practice in the city of Oakland, and I refer to it as a perinatal wellness center because the model includes the wraparound services that people are saying they want, that we're often referring people to, located in this one space so that easy, warm handoffs can happen between providers, and so that the providers can support one another and prevent each other from sort of burning out in the constant social work, really, that we're doing as midwives. Yeah, it's my baby, and we're working on expanding it to a full scope birth center where people can continue to receive those services, but also give birth in that actual space.
I appreciate you calling it a perinatal wellness center and talking about a birth center. I think often in this work and in these conversations, we get really caught up on birth center and we think one thing happens there.
Yeah.
When so much is happening there. Yeah. So you're building this, and you're building this in community.
Yeah.
In deep relationship with other birth workers, other midwives. Can you talk a little bit about you, and you've worked in this entire parts of the system, sure, right? Can you talk about why that matters? Yeah. Why this kind of independent, community-owned, midwifery-centered, owned, run, led practice is important?
Sure. So this model that I'm naming a perinatal wellness center, I think it kind of happens organically in midwifery practice all the time. We are deeply involved in these human connections with our clients. So we're listening to what they need and helping them identify resources all the time, and also figuring out creative ways to help them pay for these resources. But I envision a space, kind of like a co-working space or a perinatal community resource center, where many of these services, if not all of these services, are located in this one place where warm handoffs can happen with ease, and where providers can get consistent referrals that will support the development of their own practices. This is our way of making sure that people who don't always have the funds and the awareness of the vastness of birth work and perinatal wellness services can learn about it and then get easily connected to it. It's also a way to take care of us as providers, midwives, doulas, lactation consultants, perinatal behavioral health experts do a lot of volunteer support services, and we burn out quickly. The relationship that we have with our community and the work that we do within the medical system is not always very reciprocal. And so it's a way of building community for our clients, but also a community that we are a part of that is replenishing us as well.
So I hear you talking about this, and what it makes me think about is this is so different than our current system.
Yeah.
Right? Like this idea of shared financial infrastructure, of cooperative economics. Like it's like a solidarity economy approach that maternal health and midwifery is wrapped up into. We often center just like capital, profit, move the money, get people in and out. We make decisions in healthcare based on that. Can you talk about the power of which we use the phrase integrated capital, right? Which is all the types of capital, both financial and non-financial, which comes from other organizations in this ecosystem who've done so much work over the years. But it's this idea that we need all types of capital to make this work. But there's more to it than that, right? There's social capital, there's cultural capital, there's community capital. Can you talk about the years of that gets you to a place of building Birthland? And can you also just rewind a little bit to talk about COVID was a big turning point for you. Mm-hmm. And you started building this infrastructure at a really like important moment where the system was falling apart. So can you talk about the power of that kind of community capital in a moment like that, and then how it's propelling what you're doing with the Perinatal Wellness Center?
I think midwives of color, and especially Black midwives, had been talking about how to create something like a perinatal wellness center or birth centers that were more easily accessible. But COVID pushed us quickly, propelled us into frontline health worker status. And the additional resources that people needed became just something we couldn't ignore. All of my clients needed a lactation consultant. All of my clients needed to see a behavioral health professional. All of them needed body work because we were sitting all day long. And so it just was a model that I couldn't ignore anymore. And because I was in close relationship with so many people that I was caring for, all of a sudden their skills and expertise became valuable to the vision that we had, and they became available to be a part of our community of practitioners. We have that relationship that we have with our clients and other perinatal wellness providers. So you have that social capital or community capital, but then you also have the endless volunteer hours that midwives provide as a really valuable source of capital from my perspective. You have our willingness to show up for families despite the fact that we might not know exactly how our own healthcare needs are going to be met. Most of us have no idea how we're going to retire from this work that we're doing. The love and passion for what we do is also a form of capital. And the commitment, the persistence, and then just bootstrapping, a willingness to put our own funds into our vision. And feeling okay with that because of how much the people we care for respect and appreciate who we are and how we've showed up for them. And also their willingness to support our businesses and to see them growing their own businesses or finding themselves as a birth worker because of the kind of care that they've received from us.
The system often wants to quantify your work. Why is it of value that there are Black and brown midwives in a practice?
Yeah.
What is it that we're shifting from and toward?
Yeah. When one person has a beautiful birth experience where they discovered something about themselves and they're proud of who they are and have reverence for the people who supported them through their birth experience, that story is shared with the community and it ripples out to all of us. And it changes our collective perception of birth. We all currently are entering pregnancy with a ton of fear because we're not hearing stories that celebrate the experience, and the potential of the experience. When I hear the statistic about the Black maternal health crisis, I'm listening to what is happening to myself. There's no separation from me in that statistic. And so it requires me to take action. It requires me to be in constant conversation with myself about what I am doing and how it can change these outcomes. And it is hope what we're creating, the midwives of color that I work with through Birthland, the model that we're creating, while it centers women of color, we still care for whomever comes into our practice. And so they get to benefit from the intention that we have to improve birth outcomes for the most underserved.
When you say that about how it feels for you as a Black woman to hear that, and you're on this side where you are delivering care, it sits on my own heart because it's why I'm here in this work on the side to try and fund it. What's our opportunity for philanthropy to move differently, to fund in a way that feels like you own and hold your power still in relationship and in moving capital and resources to this work?
I mean, I think it makes sense for funders to do their research. The data is out there. It's proven over and over again that midwifery and other types of birth work improves clinical outcomes and experiences. We know that. We can stop studying this model of care. We can start trusting what people are saying about their experiences working with midwives and considering birth alternatives to the hospital setting. And then we can start looking deeply into why there is a gap between the reimbursement for midwives and the reimbursement in hospital settings, and seriously consider how filling that gap could improve birthing experiences for the entire community. And I keep saying birth experiences, but that's because therein lies the value. If someone is saying, I felt better, I fully understood what happened to me, I felt more connected to my baby, I felt more prepared for parenting because of the kind of care that I got during my pregnancy, then we won. There is the value. It's how do we put money and resources into people, programs, midwifery-led programs that are supporting those kinds of outcomes. It's also making sure that in our research around the history of midwifery and birth centers, that we remember who started these models, that a lot of this unfolded organically in our relationships with our clients and community, and continuing to protect birth workers at the center of that is vital. Removing traditional midwives, community midwives, midwifery-led models of care is just repeating the harm that's gotten us to where we are right now.
Which is what happened in the first place. It's always important to name that this is how we were, and the system did this and pushed it out, and now we have an opportunity to revive something so powerful that I think we'll need in the future. This kind of infrastructure, these webs of care are what will change everything. And it's my opinion anyway, that that's philanthropy's role, is to help build that kind of web.